Hello and welcome back. In this video, we're gonna talk about who needs to take medication for ADHD, how we decide which patients we prescribe the medication or suggest cognitive behavior therapy or both. My name is Dr. Ruben Gagarin. I'm your favorite family psychiatrist. So let's dive in. Let's start with a review of diagnosis. You can watch a little more on diagnosis in part 1 of the video, but generally speaking, as an inpatient psychiatrist and psychiatrist who mainly works in the hospital, I tend to see people who come in with more severe complaints. I see people after suicide attempts, self-harm, suicidal thoughts, who may come into inpatient unit, or the outpatient clinic accepts the patients with severe depression or debilitating anxiety. So most of the time I don't see patients who come in complaining of inattentiveness but otherwise functioning quite well. Therefore, proper diagnosis is extremely important because it becomes very complex. Typically, when I see patients with ADHD, they are in their mid to late teens. They tend to have ADHD through their entire life, but they were able to compensate, so the diagnosis had been missed. And as a result, they developed a lot of other complications, maybe drug use, maybe depression, suicidal thoughts, hopelessness, anxiety. So I have to peel the layers to actually see the ADHD underneath the soul. And as you may or may not know, I can't really read their mind. I cannot go back in time. I cannot go forward in time either. So it really is difficult sometimes to come up with the right diagnosis. We try to work together with our patients and their families to find the best solution. So in any case, for instance, we may have someone who has a lifelong history of inattentiveness. But as one patient who I saw today, she at first said that she doesn't remember having difficulties with focus and attention. So I looked at her report card and there was not a lot of evidence of this condition as she was younger. But as we try to peel the layers, we noticed that she actually did have a lot of difficulties with focus and attention. So when she was younger, ADHD was missed because she is very smart, she was getting good grades, she's very kind and personable person, so she easily engaged, she was trying to please adults, so nobody raised a red flag. Until she got to high school and all of a sudden she cannot complete her assignments, she forgets her deadlines and generally underperforms, and as a result she just gave up. She stopped going to school altogether, she stayed home most of the time, and then one after another she became quite depressed and very anxious by the time she came to us. So fortunately for this particular individual, I was able to see her in our day hospital program for a couple of weeks, day-to-day functioning, and then we were able to see that she has difficulties focusing and quite a lot of impulsivity that are symptoms of ADHD. We decided to try medication starting tomorrow. I'll keep you posted. In a brief summary of diagnosis, it is very important to understand that I don't go outside the hospital looking for my patients. They come to me with certain complaints, inability to function, maybe hopelessness, and other issues that may accompany ADHD. And then we peel the layers to understand that ADHD was at the root cause of a lot of these issues. Then it's very important to decide what to do next. And this is, believe it or not, is quite complicated. What we can do is provide social support. We can start with cognitive behavior therapy. Those two were covered in part 2 on ADHD. Please watch entire video to understand the principles of these interventions and how helpful they actually can be to manage the symptoms. In any case, even if someone starts psychotherapy, the CBT only helps to manage the symptoms. It doesn't address the root problem, which is biological imbalance with neurotransmitters in the brain. We have to use medication. Before we get to that, make sure that you subscribe to my channel, like this video, make a comment asking me questions, what you'd like to learn about, other topics on psychiatry. So, medication treatments for ADHD. Now, how do you know that you need medications? Ideally, you should start with counseling. So no medications, learning coping skills. The problem is that if you're so disorganized that you can't really complete the course, you're forgetting the assignments from CBT, you actually don't use the skills, it's not going to work. It's not a magical solution. The therapists, they don't have a magic wand to help your condition. So you have to practice the skills. A lot of people with ADHD, they have really hard time sticking with practicing. So I mentioned availability. If you have to wait for 6 months, that's another 6 months of not treating the condition. It's another 6 months when you have a high risk of losing your relationships, not enjoying your life, maybe getting addicted to drugs, and suffering from accidents. So sometimes the sense of urgency drives our decision to get started with medication treatment. So once we made the decision to start the medicine, what is our first step? Well, step one, we start with so-called stimulants. There are generally two classes of stimulants. There are amphetamines and there is methylphenidate. So amphetamines, there are medications that branded as Vyvanse, Adderall, Dexedrine, and methylphenidate is the same chemical inside, contrary to the other sorts of amphetamines, but it is different class and it is branded as Concerta, Ritalin, Focalin. In Canada we have Bifentin and Folquest. So those that I mentioned, they're so-called long-acting stimulants. In the United States, Adderall, short-acting, is available to treat ADHD symptoms, and Ritalin is short-acting, Dexedrine. I don't use short-acting medications because A, they're quite addictive, and B, the effect of that medication is very short-lived. So how does it feel to take a stimulant drug? Well, I don't know how it feels if you have ADHD. I can see from outside and I can tell you how people describe it. But I personally use stimulants. I go to Starbucks or Tim Hortons and other coffee shops to buy myself coffee. I enjoy coffee, making strong coffee at home. So I enjoy caffeine. I know how that makes me feel. And caffeine, believe it or not, it is also a stimulant like amphetamines and methylphenidate. It is just not very strong. I'll give you an example. So that one medication that I mentioned, Vyvanse, it is typically used between 30 and 60 milligrams per day. My cup of coffee has 150 milligrams in one cup, and I have like 4 of them a day. So it's like 600 milligrams of caffeine. Of course, I have side effects. I go to the washroom very often. I may have difficulty sleeping, and then I have this ups and downs of energy because what? Because it is short acting. We don't have long acting caffeine in my kitchen. So in any case, it is better to take a stronger medication at a small dose rather than a weaker medication at a large dose. Therefore, we do not prescribe caffeine for ADHD. One of the main reasons why we start with stimulants is because these medications work fast. Like my patient who I started this medication yesterday, she had response within a day. She was able to work over an hour on very intricate art project as opposed to not being able to do any of that the day before. Unfortunately, the same patient developed more anxiety and increased heart rate, so she really didn't feel comfortable. A good thing about the stimulants, they wear off in about 12 hours. It's not great for symptoms control, but it's amazing for the side effect control. So it wore off by the end of the day. We reduced the dose today. She's fine. So it is good to start with stimulants. I personally like to start amphetamine-based medications for a little bit older kids and methylphenidate-based medications with the younger kids with ADHD. However, both are approved for different age groups. So make sure that you review the side effects. Again, keep in mind that the side effects typically don't last for longer than a few hours. So that can encourage you to get things started. One side effect that we really have to talk about seriously, that is a potential for addiction. I mentioned coffee before, and I know that I'm addicted to coffee. Do you know how? Because I drink too much of it. And the reason why I drink the coffee is actually to get myself a little bit high. So I become more social, I joke around. I think people around me like me on my caffeine. The problem is that then I crash and I can't really focus, I feel tired, I may feel like taking a nap, etc. That is why we don't really use short-acting stimulants, because it's constant ups and downs throughout the day, and people with ADHD, when they take stimulants, they may become addicted to it, as I am addicted to caffeine. So, as a result, we prescribe long-acting stimulants. They last the entire day. It's as if I drank very little coffee every 5 minutes, instead of drinking a full cup in a couple of minutes, or maybe like 5 to 10 minutes, and then crashing in half an hour later. So, talk to your doctor, ask them about appropriate medication treatment for you, ask about alternatives like cognitive behavior therapy. Well, let's move on. And remember to subscribe and leave a comment. So, non-stimulant medications is a diverse group of treatments for ADHD. It is all started back in the 50s or 60s, when we still had only one group of medications that were used for pretty much everything, for depression, anxiety, and tried for ADHD. Those medications are so-called tricyclic antidepressants. I'm talking about amitriptyline, imipramine, etc. We don't often use these medications now. They're good and strong, but they tend to have a lot of side effects. So why those medications helped? Because they increased level of norepinephrine. So stimulants increase level of norepinephrine, but mainly dopamine, and tricyclic antidepressants, they increase level of norepinephrine. So what happened next? Some researchers thought maybe they should start developing medication that is similar to tricyclic antidepressants that actually works for ADHD, and they did. So they marketed this medication Strattera, that goes by a generic name atomoxetine. In structure, it is an antidepressant that increases level of norepinephrine, and as a result, it helps to treat ADHD. So after that, there was a medication called Intunif that is approved for ADHD, but it started off as a blood pressure medication, believe it or not, that blocks some of the adrenaline receptors in the brain, and through the feedback loop, yet again, increase levels of norepinephrine. So sometimes we use medications off-label, as I mentioned, some antidepressants, including bupropion, that is marketed as Wellbutrin. Some other antidepressants may be quite helpful for ADHD. Now, why don't we start with these medications? Number one reason, it doesn't work as well as stimulants. And we have to wait for weeks. So each trial, starting with a small dose, increasing it gradually, may take months. By the time we finish and we concluded this medication worked or didn't work for this particular individual, we lost a lot of time. However, if a person with ADHD cannot tolerate stimulants, or they experience more ADHD symptoms when the stimulant wears off. For example, in the morning before ADHD stimulant starts kicking in, they may have difficulties getting ready for school and work. So we need stimulant during work hours, and we need non-stimulant medication to cover ADHD for 24 hours, including evenings when people are prone to accidents, including mornings when they prone to be late for work. So often we combine those medications together. Sometimes even non-stimulant medication can help to manage side effects of stimulant medicine. For instance, stimulant medications increase heart rate and blood pressure, potentially, maybe by about 10 points. But a medication like Intunif or guanfacine actually helps to reduce the blood pressure and heart rate. Should you take medication for ADHD? Talk to your doctor. Make sure that the diagnosis is appropriate, that they ruled out alternative explanations for your symptoms. Ask them about CBT for ADHD. Try a few sessions and see if you can stick with it. However, if your ADHD symptoms are quite severe, if you're at the 7% of population that actually not gonna get much better with CBT alone, make sure that you start with the medicine and then do CBT so you can stay focused, organized, and actually practice the skills that you learn. This is an interesting question. What happens if you don't have ADHD and you start taking medication for it? Unfortunately, you would feel better, but there is a flip side to it. Although you feel better, it does not affect your performance. It does not affect your functioning. And that's what happens with a lot of students at universities. There is evidence, there are scientific studies that show that taking stimulant keeps people more awake, more alert, but it does not affect their test results. So they stay up longer, they study a little bit harder, they actually drain their body, but the result is about the same. So what I see with patients who have ADHD, dramatic improvements sometimes. Sometimes I see people not being able to focus for literally 5 minutes. They try, they walk around, they try again, they walk around, they get restless, they cannot stay focused on our conversation, and then they take medicine and they stay focused, they pay attention like everyone else. So if you don't think you have ADHD and you're thinking of going to a family doctor to get prescription to improve your function and performance, please don't, because these medications do not work for this if you don't have this condition. I'm going to be making some videos on improving your performance. Please stay tuned, please stay subscribed, leave a comment. This is the way how you do it. Ironically, although the medications for ADHD are potentially addictive, ADHD itself causes the addiction. There is 60% of people with ADHD who do develop some sort of addiction in their lifetime. Interestingly, prescription for ADHD medication protects people from addiction. Why? Watch my part 1 video on diagnosis. People who have ADHD, they're extremely bored and then they're ready to crawl out of their skin to deal with that boredom. They get impulsive, so they are much more likely to use drugs. And what I did not mention in my first video is that the drugs, the street drugs, they can improve their function, their performance ever so briefly. So sometimes people even smoke up weed before taking an exam because it helps them to stay focused better. But why don't we prescribe cannabis for ADHD? Because it's A, addictive, and it's a dead end. In the long run, you cannot smoke enough, you cannot show up for every test high. It helps in the short run, in the long run it really doesn't. Well, this is the end of this video. My name is Dr. Ruben Gagarin. Please subscribe to my channel. In the comments, make sure that you write what you want to learn about. I'll make sure that I'll make a video about that. Thank you very much. Take care. Bye-bye.